In the summer heat of the 1950s, a glass of Coca-Cola hissed open like a promise. Cold, sweet, effortless happiness. But somewhere behind that fizz, a quieter sound began to form. A question. And once asked, it would never stop echoing. At first, the drink was a symbol of modern life. Soldiers had carried it across oceans. Billboards smiled down from highways. Families poured it with dinner. Sugar meant energy. Sugar meant joy. And Coca-Cola knew how to tell that story better than anyone alive. But in labs and lecture halls, another story was taking shape. Researchers began noticing patterns: rising tooth decay, expanding waistlines, new conversations about heart disease. The word sugar stopped sounding harmless. It started sounding suspicious. The clash didn't happen all at once. It crept in through journal articles, footnotes, and quiet debates at conferences. Some scientists warned that excessive sugar could be fueling obesity and metabolic illness. Others argued the evidence was thin, the conclusions premature. And hovering over it all was a question no one wanted to ask out loud. Who gets to shape the science? As the decades rolled on, the stakes rose. The 1960s and 70s brought diet wars, fat versus sugar, while internal documents and funding trails hinted at corporate influence over research priorities. Critics accused beverage giants of steering blame away from sugar and toward individual choice or lack of exercise. The companies pushed back, insisting on balance, moderation, and personal responsibility. Meanwhile, marketing only grew louder. Bright colors, youthful faces, global reach. Soda wasn't just a drink, it was a lifestyle. And the younger the audience, the stronger the concern. Should a brand that powerful carry responsibility for public health outcomes? Or was that burden unfair, even dangerous? By the 2000s, the argument spilled into courtrooms, classrooms, and city halls. Soda taxes appeared. School vending machines disappeared. Studies multiplied. Some confirmed risks, others complicated the picture. Coca-Cola pledged transparency, reformulated products, expanded low and no sugar options. Critics said it wasn't enough. Supporters said the science was still evolving. And that's the tension that remains today. Not a simple villain and hero, but a long, unresolved standoff between pleasure and precaution, profit and proof, freedom and responsibility. The fizz still sparkles, the warnings still circulate, and every time someone twists the cap, they're not just choosing a drink, they're stepping into a debate 70 years in the making. Because the real question was never just about soda. It was about who tells the story of health, and who pays the price when that story turns out to be incomplete. If you enjoyed this story, please like, share, subscribe, and leave a comment. Your support helps the channel grow and keeps these stories coming.